Again, sodium is the primary cation in the extracellular fluid. It can combine with chloride or bicarb. This is bicarb. Yes, it has a role in acid-base balance, but we'll talk about that next week. And again, sodium and potassium, sodium, we've talked about this and we've talked about this already. So you understand already how those systems kind of relate to sodium. So we don't need to kind of go over that. This is very, very important. Make sure you understand or have an idea of these norms. You have to know sodium potassium norms. Hypernatremia, anything above 145. Hyponatremia, anything below 135. Now, we say, let's just go back to this first. We say that sodium is what regulates osmotic forces because it's so connected to water. Remember we said water follows sodium. So wherever sodium goes, water goes. Sodium goes up, water goes up, kind of, okay? So because that sodium is in all of that extracellular fluid, it's really it's really in control of that fluid shifting. That's why in all of these slides back here, when we've been talking about hypo and hypervolemia, that's why we've talked mostly about sodium, because it's really what causes all of what changes the osmotic gradients between those two compartments. Again, so the only thing you need to kind of think twice about here is that if a blood work comes back high, okay, you have 150 millimoles per liter, it can mean one of two things, right? We talked about how it can mean a decrease in fluid because we talked about that. I'm not going to go over it again. You can go back to the other videos, but the ratio of fluid to sodium has gone up because we've lost fluid, or it can mean we have too much sodium. How do we know the difference? Well, this is where I've talked about this, how we have to look at the entire clinical picture. This isn't enough information without doing an exam and having all of the other information for to identify whether it's low fluid volume or high sodium, right? We need more information. And again, anything less than 135, now we're looking at either hyponatremia, so low sodium, or too much water. We've talked about why that happened earlier. And so hyponatremia, I like this. The most common electrolyte balance in the hospital. This comes up a lot, and I'd say like most of the time it's dehydration or low fluid volume that's caused it. It's we've diluted the normal amount of sodium in the system, as opposed to we've just lost all of the sodium. Okay, let's look at. So again, this is saying what we've already talked about, right? We've talked about that. It's just a nice little picture for you to, if we have too much sodium outside the cell, it's going to pull all the water out. We already know that. We've gone over a lot of this. I'm just going through these because I want to make sure we haven't missed anything, but we've talked about all of this. What are the risk factors for hyponatremia? Advanced age, always, mental stage, fever, make sure you remember that one, diarrhea, vomiting. Why? Because these things are actually decreasing your fluid volume, right? Decrease your fluid volume, suddenly we have a much higher ratio of sodium to fluids. I understand I'm saying that a lot, but manifestations of hypernatremia, these are things you want to memorize here. Make sure you know these for any test, including your NCLEX. You need to identify what's going to happen when a patient has too much sodium, too little sodium, and as well too much potassium, too little potassium. Incredibly, incredibly important. And how do we treat oral fluids or IV fluids? It depends on how severe that dehydration and hypernatremia is. Hyponatremia, again, we've got blood work that comes back and less than 135, right? I just want to make sure I didn't. What's going to happen now? We've got not as much sodium out here, so the fluid's going to be pulled into the cells. Sorry. We've talked about all of this. So hyponatremia, often caused by an increase in fluid. We have too much fluid. It's watering down the sodium. And remember that changes the osmotic gradient. Water is moving towards where we have more sodium. Again, make sure you are memorizing these, especially hyponatremia. And again, what are we going to do? Well, it's common sense, right? And we've talked about, when we talked about hypervolemia, we talked about what we're going to do to treat. It's the same things. Same thing with the hypertonic solution as well.